Good afternoon. Welcome to the Real World Perspectives on Poverty Solutions speaker series. I'm Trevor Bechtel, facilitator of the series and instructor of the course that accompanies the series. I'm so glad to have you all here in the room at the School of Social Work and also everyone who's joining us on the live stream. Our series looks at innovative solutions to poverty across the spectrum, and we're really excited to have Representative Rashida Tlaib here with us today, representing a more political perspective. So without further ado, other than the reminder to the class to check your attendance on classquestion.com, I'm going to turn it over to my colleague Luke Schaefer for an introduction.
Thanks, Trevor, and hi, everyone. I'm really excited about today. So I'm the Director of Poverty Solutions, and when Trevor and I first ran this course, it had like 8 or 9 people in it. So it's been fun to see it grow and the incredible speakers that have come through. We see it as part of our charge to bring public leaders and policymakers into the forum and to get a chance to hear from them, hear about their ideas and what makes them tick. And we've been delighted to have connections to Congresswoman Rashida Tlaib before, having worked with her a bit on auto insurance. And actually, she was kind enough to have one of our staff members out, Josh Rivera, years ago to testify before hearings on that. She's been a leader on work around medical debt. And we know that that is a huge issue that impacts low-income families in the United States. She represents the 13th district, done so since 2019. She's a Detroit native of Palestinian heritage, a progressive leader, a mother, a daughter, friend, and community advocate. Born to immigrant parents, she built a career as a public interest attorney, challenging corporate abuses and protecting civil rights. And she made history in 2008 by becoming the first Muslim woman to ever serve in the Michigan legislature, and then again in 2019, becoming one of 2 Muslim women to enter Congress. So we're delighted in this series where we seek out partnerships and new and innovative ways to prevent and alleviate poverty to welcome Congresswoman Rashida Tlaib.
Good afternoon, everyone. Thank you so much for inviting me to talk about something I'm incredibly passionate about, but a lot of people don't report about the work I'm doing on this. So I'm excited I get to actually be a policy wonk for a little bit and not talk about the election or some of the other things that I think are sometimes pretty toxic. But School of Social Work, you guys have been amazing. Many of students have come through my office and done incredible, meaningful work. So I thank you all for that. I know you mentioned this, but I just want you all to know Poverty Solutions has been really incredible. As they looked at the cycle of poverty when it came to auto insurance, they probably didn't realize that it would lead to us looking and studying disparate impact on non-driving factors. And I do want to take a moment and recognize, of course you testify, but also showing to many of my colleagues that, the correlation between your marital status, your education level, credit score, all of those things being used and layering on top of the cost of auto insurance was actually hurting low-income families that are struggling and so forth. But yeah, in that report, I use it all the time still. There was a driver with a DUI drinking under the influence versus someone that didn't have a DUI, but he had a lower credit score. The person with the DUI, the violation of drinking and driving is pretty serious, but he had a higher credit score. He actually was paying 3 times less than the person with the lower credit score and no DUI. So just know the work that you are doing is very much giving credibility to many of my residents who've been saying something's wrong here and we need to change it. Uplifting our families in my district and addressing poverty has shaped my policy work in Congress. I represent the 3rd poorest congressional district in Congress right now out of 435. As you all know, our Michigan communities were hit hard during the Great Recession and the pandemic, in the pandemic as well, and many of our neighbors are still struggling in this recovery. As I spoke with residents in my district, I heard over and over again the issue around credit score, and it was a huge obstacle. We were talking about structural racism and talking about different kinds of structures that are in place that really kept people back. And the issue around, navigating everyday life, the issue around credit score kept coming up. And so it plays a huge influence on everyday aspect of financial decisions and being able to thrive economically. So yes, it affects whether or not a bank will issue you a loan or approve a credit card, but it also goes beyond that now. Y'all, credit score is used for housing, for employment opportunities, and how much you pay you pay auto insurance. So credit scores and credit history is now being used for all of these things that impact people's lives. In Congress, I serve on Financial Services Committee, House Financial Services Committee, under the incredible leadership of Chairwoman Maxine Waters. And under her leadership, we began researching ways to address and fix our broken consumer reporting system. I found that one of the most prominent and underreported ways credit scoring serves as a roadblock for our families was medical debt. As the core of every family's fear, as you all know, is the thought of someone in their family getting sick. And it's hard enough to experience the emotional toll of caring for a sick loved one, but our broken healthcare system imposes a harsh financial toll as well. No one chooses to get sick, let alone take on medical debt that will potentially ruin their credit. The CFPB, this is the Consumer Federation. It's the bureau that was created after when the banks really messed up. That's what I say. It's simple. Research has found, CFPB has actually found that medical collections are less predictive of future consumer credit than non-medical collections. Understand that. Like, the fact is, you're not leading to getting sick, all of these things, but they are not great ways to predict whether or not consumer credit it should be used towards consumer credit. But yet, a single unexpected trip to the hospital can saddle patients, and these are my residents, with crushing medical debt that can really navigate confusing reimbursements, OPEC like billing systems. We talk about it all the time, and obscene pricing. But one of the things to know, because I'm working on this other bill where this stays on your credit report for almost 7 years, that's almost a decade of someone's life. I'm trying to reduce that as a compromise down to 4 years instead of 7 years, because a lot of economists think that's not really a good predictor. Why 7 years? I always ask, well, why 7? I always ask why. Well, why is that the case? So we do have a bill that we did pass last year out of the House, but unfortunately hit a roadblock in the Senate to get it down to 4 years. But what's so great about the current administration and the leadership of the Consumer Financial Protection Bureau is that in March, they actually did do a report and a study. They estimated that $88 billion in medical debt is on more than 40 million individuals' credit reports. That's nearly 20% of U.S. households around our country. And most people with medical debt had health insurance. Any medical debt that shows up in an individual's credit file can be factored into their credit score, leaving a potentially devastating impact on many of our residents and our neighbors' patients' financial health. A survey conducted by the American Journal of Public Health from 2013 to 2016 found that medical debt and expenses are the leading causes for personal bankruptcy in our country. Medical debt can also cause our already flimsy social safety net to unravel altogether. And I've seen that. I've seen people give up their homes, sometimes their car, which gets them to work, and all of those things that, again, help people thrive economically. They just give it up because of medical debt. They want to live, but they also want to live without this over their heads and impact their children and their family in the future. So they don't want to leave them with all this debt. So they sell their homes. And I've talked to so many families that do that. We know that the inaccurate medical billing data contaminates our credit reporting system with little to no way for individuals to fix it. What that means is even when the insurance company messes up, it gets on their credit report. It takes them years to fix it. And there's just no possible way. And we're working on that. But still, I'm trying to just ban it altogether from even getting on people's credit report. And I'll talk about that. But as the CFPB found themselves, they found that inaccurate, fraudulent, and miscommunicated information about medical debt commonly affects individuals' credit scores. Often hospitals sell unpaid medical bills to third parties, and when they don't, they either enter into a litigation with the patients over unpaid bills. and it can follow them for years, if not a decade. From 2015 to 2019, the median amount New York hospitals sued patients over was just $1,900. And insurance companies, and as insurance companies and healthcare providers enter into disputes over billing and reimbursements, patients are caught in the middle and their credit takes a huge hit. Too often, we've seen patients rack up massive medical debt only to settle them for pennies on the dollar later down the line. The status quo simply encourages hospitals to charge hundreds of thousands of dollars for basic items like aspirin, and then insurance companies get to entangle all of that in these huge protracted billing disputes, leaving patients hanging for years on end. The system is broken, just like a lot of systems, and it's great for generating profits, but it's terrible for getting patients the care they need and deserve. That's why I introduced the Consumer Protection for Medical Debts Act. It's HR 2537. The bill is pretty straightforward, very clear. It would prevent the collection of medical debt for 2 years from the date of the medical billing to give time for insurance companies and providers to resolve disputes. It would prohibit credit agencies from reporting all medical collections for a year to ensure that patients have an opportunity to understand that they have been billed and what they still owe. Again, this is while they're sick and trying to get healthy and trying to live. HR 2537 would prohibit entities from collecting medical debt or reporting it to a consumer reporting agency without providing them with a notice of their consumer rights. Finally, it would prohibit medical debt from medically necessary procedure from ever appearing in credit report. And yes, my colleagues are like, are you talking about plastic? No, we're talking about medically necessary debt. And be very careful because, when folks call my office that have been burn victims that need that to, understanding, please don't let them drive that. I know it could be a slippery slope, but understand medically necessary procedures, again, would be completely prohibited from appearing on people's credit reports. Again, no one chooses to get sick, y'all. You all know this. Debt from medically necessary procedures has no predictive value when it comes to a consumer's credit risk and has no place on a credit report. Our work in Congress has not gone unnoticed by the credit reporting agencies. Thanks to the work of advocates and grassroots organizers earlier this year, the quote big three credit reporting agencies, these are Equifax, TransUnion, Experian, announced that they would begin implementing changes to how medical debt collections are reported. These changes do include, increasing the period before unpaid medical collection debt would appear on credit reports to 1 year. Yay. Still might not be enough. And no longer including medical collection debts under $500 on reports. Again, that's going to help a significant amount of folks, but we all know a number of our neighbors and folks have way more than $500 for medical debt on their reports. This is a major victory, though, for patients and advocates who have been pressuring the predatory debt collection and credit reporting industries to do more in protecting patients instead of focusing on their bottom line. But I do believe this is not enough. So we got to, capping the reporting of medical debt collections to just $500 or less is mere Band-Aid for the countless individuals struggling with chronic illnesses or coping with catastrophic accidents. For these patients, those with the largest and most confusing medical bills, these changes won't make a dent into their lives. During this current Congress, we've been working extremely hard towards developing legislation that would address this issue, and we wanted to get creative about going further than what the so-called big three were willing to do. So when I had already introduced the bill I spoke about earlier, I'm proud that it did actually pass this United States House of Representatives chamber, and it still awaits action in the Senate. And again, hopefully, we have lame duck. Maybe it becomes a priority then, but I think it could really change people's lives in a very meaningful way. I've also introduced a bill called Restoring Unfairly Impaired Credit Protecting Consumers Act, which also strengthened consumer protections when it comes to what is reported to the big three reporting agencies. What is interesting is something I found out in Congress because I want to do something about auto insurance, but it was very restrictive on what I could do, right? Because many of those decisions are done at the state level. And so I realized, I'm on Financial Services Committee, which I didn't actually ask to be on. They put me on there with a lot of my other sisters in service, but we caused good trouble in a very good way. But I learned something that us, Congress, oversees credit reporting agencies. We regulate them. And so that was an opportunity to figure out, well, what can we do to fight back against discrimination or against things that put people in a cycle of poverty? So the bill, HR 4115, would shorten the time period. I talked about this, that most adverse credit information stays on credit reports from 7 years down to 4 years. It would transform people's lives immediately. It's very popular in my district. It would also require fully paid debts to be removed from the consumer credit reports. I don't know if you all know, even if you paid it off and it gets on your credit report, it still stays there. An established right for victims of financial abuse, such as fraud, to have adverse information removed from their credit report. It's still incredibly hard for folks that have been victims of identity theft and fraud right now to get a lot of this removed from their credit report. Finally, I've also introduced an amendment to the annual defense authorization bill. I do not vote for the defense bill, just to be clear, but it seems to always pass with bipartisan support. For the last 2 years in a row, I did introduce this amendment to help our service members because it's relevant to the bill. So the amendment applies that all of the protections from the medical debt bill that I talked about would apply to our service members that hold medical debt. As I researched this issue further with my colleagues, I realized the issues of debt collection particularly affected our much younger service members and veterans who have little credit history upon enlisting. Among service members with 3 or fewer years of service, the CFPB has found that 5% had medical debt in collection just prior to separation from service. And so that number doubles to more than 10% within a year of their separation from service. So it is going to be able to help our young service members. A single medical debt and collections can wreak havoc on anyone's credit. Unsurprisingly, though, our service members with 3 or less years of service with medical debt and collection on average exit the armed services with a subprime credit score. Meanwhile, service members and veterans are twice as likely to submit debt collection complaints as the general public, and medical debt concerns comprise nearly 13% of service members' debt collection complaints to the CFPB. Again, incredibly important information to understand why this amendment and why we got to look at credit reporting very differently. So I'm proud that our service member protection amendment was included. The amendment was included. It was adopted in the fiscal year 22 defense bill, or NDAA they call it, last year on a bipartisan vote in the House side. But again, the Senate stripped these critical provisions out of the final bill, unfortunately, which is surprising to me because we did get bipartisan support for it. This year, when we reintroduced the amendment for this fiscal year 23 for the NDAA, these protections were actually included unanimously by the House. And so again, even gotten further support. So we will continue to push our friends in the Senate to ensure, and that's a nice way to say, wake up folks over there, in the friends in the Senate to ensure that we continue the progress on this particular issue. But we all know, I think from all the information I provided, that we do really have to fix our broken healthcare system altogether. But in the meantime, I want to try to make these reforms, as I said, on Financial Services Committee around medical debt collections and credit reporting. Thanks to the corporate greed of hospitals and insurance companies, Americans pay the most expensive health care prices in the world for receiving far less care than patients in comparable countries. So they're paying more for even less services. It also won't surprise any of you to learn that I've been a proud supporter and co-sponsor of Medicare for All since my first day in Congress. And I just want you to know, I bring that up because sometimes folks think this is it, this is what we need to do. I think we need to do both. And so we got to fix our broken healthcare system as we take on structural issues like credit reporting. But undergoing a medically necessary procedure should never haunt someone financially. And so enacting protections against predatory medical debt and credit reporting industries is critical. These protections are critical to ensuring patients will be able to fully recover physically and financially. What I do know is the more I do work on credit reporting, the more I hear from folks around the country who really start sharing their stories of how it all happens. And it's always when it's never been planned. And it's always at this moment in their lives where they just is so unexpected. And they, even as they get better, they survive, maybe cancer, maybe a political, a procedure that they had to entail years ago. It literally still is part of their lives and not being able to financially thrive afterwards. So I'm really glad that folks are now starting to talk about it. And again, I think the current Biden administration under the current CFPB leadership, for them to actually study this and look at this is really great. And I believe the CFPB director even said to me, I wish we could have a thoughtful and a very aggressive conversation about this, like we do student debt, because he feels very much that with 20% of households around the country being impacted by this, that it should be discussed in the same kind of passion and commitment. But with that, I want to open up for any questions.
Great. All right. So we have a mic, and Trevor's going to be going around. I have a couple questions, but I'll just get us going with the first one, which is, as you were talking, I was just thinking about how divorced the charges in the healthcare industry are to what is actually provided. And so I wonder, why do you think that's the case? And is there anything, so Medicare for all is maybe one thing where you have one you can negotiate. Are there any other ways? And how do they get away with that, I guess, is sort of my starting question.
Yeah, look, so the healthcare industry is built very separate from how, it's almost like to understand that even though some of our hospitals and so are under so-called 501c3s, if you look at how they're structured, some of them actually have shareholders. No, it's really actually just bizarre when I tell my residents that, like for instance, the Beaumont system, that they're kind of taken aback that it's more functioned and structured as like a corporation. So when it's functioned that way, then who do they serve? Do they serve the people that are sick and they're intended to keep alive and make sure that they have a thriving life, a good quality of life, living with an illness or not, or a condition or not, or is it to the bottom line, the shareholders? So it's very hard when you have shareholder meetings over here, but then you have discussions and stuff about healthcare over here. And I'll tell you, even during the pandemic, when folks were talking about beds, when I was calling my hospitals and saying, "Hey, I heard you're running out of beds," it was because some of those beds were put aside for some of the surgical things because they still needed to make money. And so it is hard when you have two interests here: profit, shareholders, business kind of conversations, discussions around decisions around profit-driven decisions versus, the nurse on the ground, the doctor, the patient, and those folks who are, many quietly are now speaking out. They are speaking up, not as loud, but they are saying now that if anything, the pandemic exposed just how broken it was and how unsafe it was to have folks in the system like this, where decisions were made not to keep folks alive, but how much will it cost them? And so we do have a for-profit healthcare system. It's something that is going to continue to drive these decisions around healthcare in a country until we can discuss Medicare for all in a very thoughtful way. I know that there isn't anybody in our country that thinks our healthcare system is wonderful and it's doing very well. Maybe shareholders, but other than that, I don't think. I think many people want something done in regard. But I push back when hospitals send the debt, especially when it's a small amount, to debt collection agencies. DTE does it. Everyone does it for as little as $500, and they'll call your workplace. I've had a resident tell me they've called family members looking for them, and it's really very traumatic and hard, because it's like they feel like they've done something really terribly wrong. And I said, you didn't do anything wrong. You just got sick. So it's really hard when folks are not leading with compassion or empathy, and it's more, we need our money.
First of all, thank you for being here. This has been really interesting to listen to. You brought up how, like, there are these huge profit motivations. And I'm a type 1 diabetic, so I understand the amount of money it costs to buy insulin and then all the supplies that go along with that. And like you mentioned, like, I never expected to get sick. I didn't do anything to get sick, and yet I have to live with this for the rest of my life. I was wondering what kind of solutions you see, and I know that California recently kind of proposed that they were going to start making state like making insulin, and I was wondering if you see that as like a future possibility, like federally. I know that was
No,
like
we make insulin.
you make insulin.
Yeah, and then
Okay.
they changed it a little bit, and then they'll go patent it and make money off
Right,
of
that's
it.
what I
No, if you look at the research and development, much of what is out right now in helping folks live
yeah,
with,
it's just slight modifications on the
Mhm.
patent.
and then they
Okay.
patent it, and they
Okay.
go make money.
Okay. How do you think this like California kind of approach do you think it will do anything, or it will be
If we can take the
similar-
for-profit scheme out of it, absolutely.
Right.
You're gonna be able to afford it, hopefully,
Okay.
because the people that are in charge are people that you elect,
Right.
right? Not,
In an ideal world, yeah.
Yes, I know. Yeah, I hear you on that. Thank you for that question.
Thank you. So my question is like the issue of medical debt it's not a new one. It's been kind of a long-standing problem. Can you talk about like the policymaking process? Like when you were like writing the bill and talking about it, how did you decide what solutions to kind of include and what to leave out?
So it's an interesting process because it was part of a whole package of bills to look at credit reporting. A lot of folks wanted to deal with how do we take negative, folks have already paid, like, why is it still on their credit report? How various debt is weighed, differently from other debt. So it was part of this package. But, primarily I work with the House Financial Services Committee staff who sometimes will work if it's a friendly administration. I mean, this past cycle, it's been an incredibly friendly administration and who have actually wanted to study this, look at this. And so you primarily work with, some of the leading experts on that committee, but you also reach out to some of advocacy organizations. In this case, it wasn't like one particular one that was working on it, but I can't remember what they're called. It might be consumer law or something. I can't remember. I'm terrible. My staff always remembers everybody, but they, they're working on poverty solutions, and how to uplift people out of poverty. And also barriers to employment is huge, in housing. They work huge on housing. So they saw this as an opportunity, even though I'm looking at it from, a various lens. They saw it as a way to help working families or low-income families be able to access opportunities to thrive. There are certain professions now that you can have a utility, or ER visit that's on your credit report. They won't hire you. You will not be able to get that job. Even if there's a negative mark, say you paid later, you still won't be able to get that job. And especially around housing now more than ever, any negative markings, even if you took care of it 3-4 years ago, it's still showing up in your credit report. It may lead them saying, I'm not going to rent to you, or I'm not going to, allow you to be housed here. But it's House Financial Services Committee has some really great folks, some of which I think somebody on our committee actually used to work at CFPB too.
Thank you so much for being here. My question was just, have you faced any kind of pushback from, the debt collection agencies and the credit agencies or groups representing healthcare, all kinds that would be involved in this, and how you kind of dealt with that?
Ironically, we have not. I don't know. We haven't. I ask all the time. We haven't gotten, we'll get some strong letters about other things I'm doing, but this one in particular, I have not. When for instance, even on auto insurance, when the CEOs of am I saying it right, Ranger? Equifax, Experian, and TransUnion, those three leading reporting agency came before my committee. You could tell they really didn't. I said, hey, do you send our credit score to, our credit reports to auto insurance industries? Yeah, we sell that data to them. Do you know what a credit score has to do with somebody's driving history, if they can drive well. I don't know. They don't care because all they want to do is sell data. So I don't know, I haven't had them come back and say, no, we're not doing this. If anything, they're obviously watching and now making decisions on their own to address this issue around credit. I mean, $500, it could have done better. But I know they're actually paying attention to this because it's now not just members of Congress and like myself and this committee that passed it and the House that passed it. It's now CFPB that's looking at it aggressively. So, but we haven't, ironically, I thought maybe the hospitals, no one has reached out and said, don't do this. I am still very shocked. I cannot explain this to you. Like, this NDAA, what does it stand for? National Authorization. Yeah. The acronyms in DC are really interesting. So the NDAA always passes, and putting this in there, first getting bipartisan support for it my first term, and then the second term just unanimously getting support. No one asked for a voice vote, which is great. That means it's non-controversial. It's always a sign that this is something that is widely supported in Congress, in the House side, that they would strip it out. I still have not gotten a reason why. I'm really taken aback because, again, the data that we're getting from CFPB about our young service members is pretty impactful. And if we're going to, want to continue supporting our veterans, this is a really critical way of being able to do that. But unfortunately, the Senate stripped it out.
Yes, and thank you, Representative, for your work on this. I believe strongly in these policies, so I'm really glad that you're fighting this and advocating for this. My question is with regard to coding, billing.
Oh, yeah.
I don't know if there's something outside of your purview, but I notice this seems to be an issue that keeps coming back to you with debt. What are your thoughts on that, if you have any?
Yeah, no, I hear from my cousin who works at a hospital that will be, say, unnamed, but it is very interesting because the person entering the data, she goes, has to be trained on what code to use, and she said more often than told publicly, the coding is completely sometimes just a mess. There's no consistency. So somebody that puts it in a certain way and they're like, oh, that sounds right. Let me put it in that way. And then it goes to insurance company and it's the wrong code. You have to then, and you hear from folks that are sick that have to do this. You put the wrong code in, it's not the right code, to try to go back and address it to get them to, all of that. There isn't even a process to really do that in a very timely, effective way before it gets to a collection agency. But every hospital does it differently based on insurance care. So it depends on where you go, because some insurance carrier, they'll take some insurance carriers, some not. I heard sometimes the coding's different if it's like public health insurance, like Medicaid, or Medicare. But I definitely would, ask my residents all the time to ask about that, to question it. And to keep trying to advocate to make sure it's accurate as much as possible. But he's absolutely right. At the point of you coming in to get care, you coming in, you want to get sick, you're focused on, is this doctor know what they're doing? Is this the right care? Researching on your own, is this the right meds? Is it the right post care? You're worried about that. In the meantime, there's somebody over there putting this into a system and using various codes that will result in whether or not this is reimbursed or how much it's reimbursed. And so there is obviously, but it would, if we get the for-profit scheme out of it, then we might not have to worry about coding.
Thank you so much for being here. Bracketing kind of the political constraints, I wonder what you think a progressive vision of a credit score system would look like.
I don't know. I'm working on this one right now. The question was around what a progressive vision on credit reporting be. I understand that folks that look at, predictors for credit, need this kind of data, okay? But I hate that it's being used for things that I think are, for instance, somebody's school or going to the hospital or doctor is weighed the same way as if you went and bought a Ferrari, you know? Is that literally, and most of the times it's not that. It's not because you're out there, you know, because the image of, oh, you have all this bad credits because you're out there, you're a big spender. You know, it's true. It's society has said that's what it is. It's no, it's unpredictable, you know, things that are happening to people's lives, all these things. A really great progressive vision for credit reporting, for it to not be used outside of, you know, something that I think is not needed for somebody's quality of life: medical care, housing, employment, childcare. I heard is even now using, you know, people look up and say, am I going to get paid? Let me look at, I just don't want it to be used against a hindrance, because I noticed that in my community, for instance, people don't build up their credit either because of structural racism, to be honest, and they're not getting the loans like everyone else is, or the credit like everyone else is, or, you know, their assets are much less because of where they live. But they also deserve healthcare, they deserve housing, employment, and childcare, and all these things. And so a really great progressive vision is not for it to be used or weighed for all these other issues. I just don't think it's fair.
I'm going to actually ask a follow-up. We had Louise Seamster speak in this series a couple of weeks ago. She talked about the connections between student debt, which she did a lot of the architecture for the student debt relief plan, and municipal debt, like the water debt in Flint, and noted both of these things were kind of extracting wealth from low-income communities. And then the financial system kind of designed it so that a lot of that wealth would flow to investors. And I'm sure that a lot of that similar kind of thing is happening here. I wonder if there's anything you'd like to say beyond credit reporting to kind of address this kind of more general question with the system.
No, we already know this is happening. I think just as this is me speaking on behalf of my residents, they're really tired of being studied. And I know we're in an academic world, but they really are. They're tired of folks. We already know this. Like, people tell us this all the time, and they'll come with new reports to tell us this is happening, but it's been happening. Like, we already know. We already know that our housing is not of quality. We already know that we're not getting the loans, or we already know all of these things. I just at some point need there to be acknowledgement of it if folks really want to address the chronic issue of poverty in our country, because it does cost, you know, if you want to talk the economics, it actually costs us more to actually not address poverty in a very aggressive and very meaningful and transformative way. And so I mean, that's my answer to that. I mean, I would get it, and I'm there, and I think that's why, you know, I'm introducing things that are close to universal basic income, and folks are like, oh my God. But, you know, ending child poverty in our country is really important. And so the End Childhood Poverty Act, for me, raising children that are in deep poverty, you know, 63% would be uplifted with this act. And it takes all the child, like what we did with the child tax credit, earned income tax credit, all of that. And at that time that child is born, just like you sign up for their Social Security card and all of those things, at that moment they are enrolled into this program. They will get an income of $383 a month until they reach 18. And folks think, oh my God, you know, but don't be surprised in 2030, you know, who knows when. I'm going to keep pushing. But I really think this is the only way to, if you're going to try to address the true economic divide or disinvestment that's happening, because those folks that are driven by profit are never going to do it unless we decide as a country we'll do it ourselves. And we seem to constantly, you know, have great committee hearings and conversations of what you just explained. We've had people tell us that. And then we'll introduce various legislation to try to uplift folks. And then they always fall short to actually pushing back against investors to be able to extract like that. It's such an aggressive way. I look at private equity firms right now in my community that are taking all the homes that are less than $100,000, turning them into rental homes, no access to home. And we lost more Black home ownership in Michigan than any other state. All that is because the extraction still continues to happen. But yeah, at some point, I just want to say that because I tell folks when they want to create, come to me and they talk to me about this. I was like, great, I understand, but please, no more task force, no more studying. I promise you, we got it and we know it. If anything, come to us with policy solutions. Really, we're ready for policy solutions. Like, come to us and tell us what you're, what you've studied, or, hey, they're doing this in California. Like, that's exciting to me. I'm like, they are? That's amazing. Michigan should do that, right? I mean, so there's some sort of conversation after that we're actually talking about real solutions and policy answers.
Thank you. I love that point. So it's a follow-up to what you said and what has been said before, where the clear reaction is we know that. And the question before that was, how can we design a progressive system? So the question to you is, I agree that as academics, we've been good at describing things that you may have already heard
We
about.
need that.
Right? And we need that. But it seems like there's an expectation that we could do more than that. So I wonder what your call to us would be, and more specifically, not only to come with the policy solutions, but also do those policy solutions also include ideas that are currently not part of the conversation, right? Are these new policies that we need that can't just be studied with, something's been implemented in California, which is great. We can study, we can, estimate the effects of it. Could this apply in Michigan too? But would you also expect from academics to come to you with a broader vision of policies that have not been implemented, also equipped with, empirical work to say, this is what we expect to come out of this? Is this an engagement that you would welcome?
I'm going to answer this with an example that just happened yesterday. Okay. So we have I call her Detroit's professor, Professor Bernadette, who's been working on this whole overassessment of property taxes in Detroit, 600 million. They did a big report, showed all of these things. I was a young, I wasn't, I was a few years ago, but I was an attorney at Sugar Law Center, and I, get this call saying, hey, we're getting some folks that are saying this is an issue. Could you file a FOIA, Freedom of Information Act, to find out this happening? So we find all this discrepancies, people getting their notices like after the deadline to appeal their assessments, all these things. So overassessment happened, period. There's enough information and research and data, factual evidence showing that. So she didn't stop there. She created a coalition. And this coalition now had a second meeting with HUD to talk about a national database, technical support, and everything, because they don't want it repeated. It's not just in Detroit, it's really in other communities where overassessment is happening, especially in low-income communities, and how that has been chipping away at homeownership among especially communities of color, but low-income, working-class communities. And so it's now leading to actually possible policy change. So they're in a room talking about this. So she's like, look, University of Chicago is already doing this. Why can't, like, the person at HUD's like, let's have a meeting with them. Let's talk to them about it. Because to me, the private sector and for-profit corporations are really good in saying, we'll do it right here. Give it to us. We'll run your unemployment. Like we'll do, they mess up they really mess up horribly and like walk away from. I feel like there needs to be more partnership in that way. I think with the academic community or universities and others in this element, because when they went above and beyond what they found, they felt like, okay, we can't stop at just studying this and researching this. We got to go and tell people this is what we think the solutions are. And so even though it's only been 2 meetings, I really think it might actually lead to a very thoughtful action on the part of the federal government in playing a bigger role in providing support to communities that are struggling with doing their assessments in a way that's equitable, in a way that is not, over-assessing low-income communities. And so I just give you that example. It's phenomenal. This is the first time I've been in the state house for 6 years, and now I'm going on, ending my 4th year in Congress. And, this professor has really shown me an opportunity here. I'm like, I want to do more of this because members of Congress are not like, we don't like, right. We know what the issues are and solutions. And I know from my background what my limitations are, but I'm going to reach out to my committee staff. I'm going to say, this is a chronic issue. Is it true? What's going on? Talk to the Congressional Service, Research Service folks, all of that. But at the end, she gives credibility to what I'm saying. I mean, from letters that I put on my letterhead, questions that she's, her and her team and the coalition are asking, I take those questions, put it on the letterhead, and I send it to the agencies. And we get more information and more information. And now we're actually having a conversation about what University of Chicago is doing and whether or not there could be a partnership with the federal government in doing a database around assessment in our country. Yeah. This is Andrew Gadaris, who works for me. He's my senior policy advisor.
What's so effective about Bernadette is that coalition is so thoroughly rooted in community
Very.
and in the people who were overtaxed. So she has so much credibility. She is speaking on behalf of the people who have come up with their own solutions. And so, it's not necessarily like she came up with a new idea.
Mm-mm.
She came up and is advocating for the idea that the people most affected by have said is the idea they want. And that is when we're in that meeting with HUD, they know that she's not just speaking from an ivory tower, she's speaking from the streets of Detroit where they care about what happens there. So.
And what she did too is at the same time, she says, Rashida, this is the first time I haven't done, like, she's a law professor, so she hasn't actually practiced law, but they have also now have a team of young student attorneys and herself helping people appeal their over assessment. So in the meantime, she's also doing what I call constituent services. So she's providing services and fighting over assessment. And so she's like, hey, if you're getting over assessed, send them the cases our way. We're working on those in the meantime of trying to change it. So that we can actually stop it. So that is also gave folks trusting, like, oh my God, I got a lawyer, a free one to help me. Oh my God, and they're helping them go through it because it's a very intimidating process. You go through the state and the whole appeal process is just really rigorous, and you get back and it's kind of this terminology you don't understand. And so they've also been doing that at the same time. But it's a great model to actually look at. And they've been building this coalition for 4 years now. I think it's going on 4 years. Yeah.
My question,
Mhm.
until they screw up,
Mhm.
and they get for them. But I know some advocates decreasing affirmative, like payments, like mortgage payments.
It technically is. It's showing that you have, no, it shows that you have, so any debt you have is on your credit report. But it shows whether or not your debt is like wiped out or it's late or you haven't paid it or anything like that. But I'm not gonna, I don't know if I would be a proponent to giving the 3 monopoly credit. Because by the way, other folks have tried to open credit reporting agencies and they swallow them up. Like, that's why there's only 3. That's not like capped or anything. We can have more if they want, but every time anybody tries to, these 3, they swallow them up. So they're like the only 3 that is like working out in this space. But I don't know why we'd give them more data.
Yeah,
Because they already want to do algorithms, you know that, right? No, they want to use algorithms and what you guys are doing online and stuff as part of their credit, which I don't wonder. That's very dangerous.
I agree.
Because the more data they can collect, the more they can sell, make money. Yeah.
I think it's an interesting.
It is. No, I like, that's what's so great about the academic world. Like, it sounds really interesting and it sounds like something really positive. I just don't know in the scheme that's so driven by for-profit, like how is that gonna, because it's just gonna, folks that have access to credit will continue to thrive and those that don't won't. Because just to be clear, when you go and get your first mortgage or whatever, all that is gonna show up. She pays on time. It all shows up anyway. So towards your credit report, I only know because, like, when I sold my last house, I'm like, oh my God, why did it jump? It jumped, like it like jumped in a certain way because they knew like what was sold. I don't know. It's just like, it's very odd to me that, uh, again, that you would say it that way, because to me, it's already on there and it's already being processed in the credit. It is already being processed in the credit report. Could be wrong, but again, I don't know if my service members would thrive from that when they don't have any affirmative payments to put on their credit report. They have medical debt. Yeah. Yeah, they want to use, I think I read an article a while ago, it came up. It's funny, it came up on my thing because I probably know I'm working on it and my phone's listening to me. But it came up and it was around the idea around using its various algorithms and incorporating that into calculation of your credit score. Super scary. Okay.
We're going to take one more question from the audience, and then I'll turn it back to Luke.
Hi, my name is Becca. I'm a social work student. I've actually worked with your colleagues, Anna Eshu and Stephanie Chang, so I was really excited to hear you speak today. But my question is regarding algorithmic bias. What do you see as solutions to these systems of automating inequality, essentially, and how do you envision the future to look for that?
Yeah, I mean, I don't have an answer for it, but I do know, and this is maybe the lawyer in me, I do believe you're going to see some court cases and others fighting back against using our algorithms for privacy purposes. And I don't know what those precedents is going to be, but I think what we do online, our phones, everything from looking at alternatives for living with diabetes, all of whatever it is. These are private research and decisions that you're doing on your phone. For me, my legal counsel, it's like, when do we cut off, when does the right or privacy get jeopardized or impacted by folks having access to things that we're doing when we didn't sign off? Technically, we are signing off on it because when you sign up for the app, you are. But I think there should be a full-blown conversation, and you should be part of it since you think, I'm serious, like really in-depth, dig into a conversation around privacy and the use of algorithms in this way. And again, they're not using it to benefit us. They're using it because they can sell info and sell data on you and your life, how much you sleep, how much insulin you use. I mean, it's ridiculous. I mean, all of those things are very much private decisions. And I wonder, when we're going to start seeing folks pushing back and saying this impacts our right to privacy in our country.
I just wanted to ask one final question, and then wanted to end and give people a chance to say hello and the last 5 minutes get you out the door. But you mentioned the Senate a couple times, and I remember hearing a quote from somebody in the House years ago. It's probably not true anymore. Say, the enemy is the Senate, and I wonder how you think about the two chambers and why good things seem to die there.
Yeah, I don't know. I mean, it's interesting. Congressman John Dingell wrote his book. I can't remember what it's called. It's called I don't know. Anyway, I believe he technically, I don't know if it's Don Young or him, but he's the longest member in Congress, I believe. But he did write a book, and it's interesting, and nobody picked up on the fact in his book, he said that we need to get rid of the Senate. You should check it out. I mean, he's the longest serving member of the United States Congress in our history. Like, let's see what he said, but I think it's because there is a conversation about whether or not there's enough representation, obviously in the House with 435, we each of us represent about 700,000 people. And that fact that in the Senate, I believe he was saying is, every state has two, even though one Senate member, in West Virginia, has literally 20% of the people I represent, literally a much smaller population of folks that he would represent compared to my House seat. And so it's just something that I know has been a conversation before I even showed up to Congress. And, I think John Dingell, said it, and I thought it was very interesting that it comes from, someone that, again, that has been there such a long time, that he felt very strongly that if we want to fix our democracy, we got to get rid of the Senate. He said that, not me, because now it's going to be quoted. I'm just sharing if you guys want to check it out, what he said.
We're going to draw it to a close now. Thank you, everyone, both online and here.